Well, good afternoon, everyone, and welcome to today's webinar. I'm Susan Ryan, the Senior Director of the Greenhouse Project, and I happen to be a nurse. And so for all the nurses out there that are joining us today, I want to just let you know how much I appreciate you, all of your hard work, your efforts, your healing hearts, and all that you have done, especially during the past year. I think a year ago when we looked at the pandemic that was upon us, we had no idea what a marathon it would be, but we are so grateful that you have persisted. We're going to talk about resilience today. We are really excited for what this webinar will do to go from trauma to tranquility. And we've got an incredible person to help us through it. I want to, first of all, acknowledge our sponsor, and that is Select Rehab. Select Rehab has I met Select Rehab years ago in my tenure with Greenhouse. And here's what I want to say about Select. They are the nation's largest provider of contract therapy services, serving more than 2,300 post-acute skilled nursing facilities, CCRCs, senior living communities, schools, and home health locations in 43 states. That's nearly all 50, guys. Select's commitment to clinical excellence, quality care provision, outstanding customer service, and proprietary technology solutions have earned the company a strong reputation in the industry. To further its commitment to clinical excellence and customer support, Select Rehab has implemented a nurse consulting division to assist clients with all areas of your nursing needs. In this ever-changing world of long-term care, with all of your nursing needs related to clinical compliance and reimbursement and operations, how important it is to have that nurse consultant perspective. Additionally, Select has entered into a strategic partnership with VirtueSense and will implement their industry-leading VST balance, which uses artificial intelligence to proactively identify fall risk in older adults in thousands of senior living communities going forward. Select is committed to delivering person-centered care and working with the Greenhouse Project to deliver exceptional services and outcomes to its members. And once again, we certainly have enjoyed working with Shelley and the team and everybody at Select Rehab. So today, I think it's so appropriate that Barbara Patterson-Paul is going to be our speaker today, because Barbara is a career nurse who has spent 40 years committed to ensuring person-centered care. The last 25 years has been in the management of both acute rehabilitation and long-term care. I would say she has held many other positions, and what they have in common is that she is passionate about supporting quality and nurse leadership. Currently, she's the Vice President for the Nurse Consulting Division at Select Rehab. And as Barbara and I were talking before we got started today, I can't tell you how excited I am to hear more of her story and to hear more about what insights she has gained to go from trauma to tranquility. And Barbara, I'm going to turn it over to you, and I look forward to hearing your presentation.
Hi. Good afternoon, everybody. Thank you so much for having me. Thank you to the Greenhouses for inviting me to do this great presentation for them. As Susan said, my background is in nursing, long-term care, and when COVID started, I was a corporate nurse for a large nursing home chain in the Northeast and found myself on the front lines in a nursing home in Queens as the only nurse in the building pushing a cart. It probably was one of the most traumatic experiences in my life, but also one of the best experiences in my career. The people that worked side by side with me and helped me every night when I came into that building, and helped me know the residents better, and helped me know the residents' personalities, and worked and took care of me in the building every night. They're forever in my heart. So it's a pleasure to be doing this, and I really was thinking about them when I created this presentation. So from trauma to tranquility, it's trauma and resilience in the time of COVID. So just a little bit of housekeeping. We need to, because we have CEUs offered, the learner must be logged into the session for the entire time. The learner must complete the session evaluation at the conclusion of the webinar. The learner must log into the SurveyMonkey and complete the session evaluation within 7 calendar days of the CE activity. And a certificate of completion will be mailed to all participants who meet the attendance criteria within a week of the webinar.
Barbara, we're not seeing your screen.
Oops, okay. Let's go back and see what I did. Okay. Okay, well, I'm seeing my screen, so I'm not seeing the webinar.
When you click share screen, just click on the PowerPoint directly.
Okay, all I'm seeing is my PowerPoint.
Janet, do you have her PowerPoint? Maybe you could.
Yep, I can bring it up for you.
Perfect.
Okay.
There's always more than one way to get this accomplished, Barbara. There we go.
All right.
Just tell
I saw
Janet
myself
now
for 1
when
minute. All right, so
There,
the
we were on the
objectives, the
agenda.
learner will be able to verbalize 2 ways COVID-19 pandemic caused trauma for healthcare workers. The learner will be able to name 3 symptoms of trauma, and the learner will be able to define resilience. Can I change the slides now? Okay.
Just let me know when you would like to move along. I'll move them
Okay,
along.
so COVID-19 caused many hardships for healthcare workers, loss of life, residents that we knew well. I know I have many friends in the acute care setting, and they certainly had a difficult time during COVID. But people came in, they didn't know them well, they didn't have the relationships with the families that we have. So although they were dealing with the loss, I think it hit skilled nursing facilities a little bit more personally. Working in full PPE, all shifts, was a difficult way to work. We had masks, we had face shields, goggles, gowns. I tell people that when we were using raincoats and garbage bags as hospital gowns, we knew we were struggling. When you came to work, you didn't know if you were going to get off after 8 hours or 12 hours. There were a lot of people working extra shifts, filling in for colleagues who were either furloughed because they had been exposed to the virus or had the virus. We had the fear of infecting our families. I know for me, I have an 87-year-old mother. I would come home, come in through my basement, change my clothes, put them directly into the washing machine before I would come upstairs to take a shower. So there was always that big fear of infecting somebody in my house. The constant changing of guidance and recommendations. COVID is a novel virus. It was new for everybody. So what we thought was the right thing to do today may not have been the thing that they directed us to do the next day. So, just as a management person, getting the guidance and then educating staff and bringing the information back was not an easy thing. Our residents suffering from isolation and leaning on us for communication, taking on our residents and their families' traumas, a feeling of helplessness and hopelessness, decision about taking the vaccine or not, and fear of losing your job or loss of income. We can go to the next slide. Okay, mine didn't change, so I'm gonna, hold on. Okay, I'm sorry. Can you?
Time for the poll?
The next one is a polling question, yes. So The first polling question we're going to ask is, have you experienced one or more of the hardships from the previous slide? Do the results come up on your side?
Yes, I'm seeing the results. I'll get ready to share those in a minute. Let's end the polling. All right. It looks like we have about 82% said yes, and 18% said no.
Wow, 82% had one of these hardships. That's pretty amazing. We know how hard COVID was, but that 82% is a big number. Okay, next slide.
And it looks like I have the wrong.
So 3,400 US healthcare workers died from COVID, and that was a date from April 2021. Not only I have lost coworkers that I know, but not only have I lost coworkers, but they developed COVID, they recovered, and then somebody in their family passed away from COVID. So it's a very traumatic time for all of us. Next slide. This is a number I think we've all heard over and over again. 40% of COVID-19 deaths were residents in skilled nursing facilities. And I think what we have to remember is COVID, the disease that it is, attacked the elderly at a much higher rate than it did the rest of the population. But still, 40% of COVID-19 deaths were in skilled nursing facilities. Next slide. I think the trauma of the constant media coverage for COVID-19, and then the constant media coverage about long-term care facilities or quote nursing homes. You know, as hard as we were working and going in every day and doing the best we can, we would come home, turn on the TV, and not only would the media be covering the number of COVID positive cases, the number of COVID deaths, but they would also be talking about the amount of residents who were passing away from COVID in skilled nursing facilities. It was very disheartening. Next slide. So when I thought of this, when I first started putting it together, I thought of these 7 stages of grief. So first there's shock and denial. This is a state of disbelief and numbed feelings. And I know in the beginning of the pandemic, where it was a lot of shock and a lot of denial. You know, there was 1 case, then there was 10 cases. It was on the West Coast, then it was on the East Coast. You know, very quickly in New York City, we felt the pain of COVID, and the shock was there, but the denial went away very quickly. Then there was pain and guilt, anger and bargaining, depression. I feel now we're in this upward turn. I don't feel we're to acceptance yet, but we're definitely in an upward turn. Reconstruction and working through, and then acceptance and hope. So I think what we have to look at is that there is a light at the end of the tunnel, and that we are going to get through this. And we're all going to remember this pandemic and hopefully learn some lessons from it. Next slide. So some of the signs and symptoms of trauma are feeling irritation, anger, or denial, feeling uncertain, nervous, anxious, feeling helpless or powerless, lacking motivation, feeling tired, overwhelmed, burnt out, feeling sad or depressed, having trouble sleeping, having trouble concentrating, and either poor appetite or overeating. And those of us who do the PHQ-9 interview on the MDS will recognize a lot of these symptoms as part of the depression profile that we look at with the PHQ-9. So in doing the research, there was a lot of what can we do for healthcare workers articles. And I read a tremendous amount of them. And the statement that I came away with that resonated most with me was, what do healthcare workers need? And the answer was ask them. What's important to me as a 60-plus-year-old woman in my place in my career, and a mother who has 2 school-age children who she's been homeschooling since the pandemic began, is very different. So what we can do for our employees may differ from employee to employee. It's important that what we give them is what they want. The help we provide is the help that will really help them. And I was telling people, one of my suggestions during COVID in the building I was in was a lot of my CNAs took public transportation to work. They rode a bus, they rode a subway. And I was asking the owners, couldn't we provide them with a car service? First of all, so that they're not in public areas and being exposed to COVID more, but also so that their commute to work is no longer 40 minutes or an hour, but it's 10 minutes from somebody picking them up in a car service. Next slide. So communication with your coworkers, supervisors, and employees about the stress. And I think it's really important that we talk openly about how the pandemic is affecting us and did affect us, identify factors that cause stress and work together to identify them, and ask about access to mental health resources in your area if you need them. I don't think anybody should be embarrassed or ashamed. What we've been through was absolutely life-changing. So if you need help, ask for help. But I think just talking with each other about what we went through, and residents, maybe it's time now where we can talk about residents that we lost and talk about them in a happy way, and remember the good times that we had with them. Strategies for coping. Remind yourself that everyone is in an unusual situation with limited resources. And I think we felt that very strongly in the long-term care industry. Identify and accept things which you cannot have any control over, and recognize that you're performing a crucial role in fighting the pandemic, and that you're doing the best you can with the resources available. When I was going into work every night, and I actually live an hour from the facility, and coming home from work after 13, 14 hours. And one morning I pulled up into my driveway and somebody had put the healthcare hero, thank you healthcare hero sign in my driveway for me to see when I pulled in. And I actually broke down and cried, because I felt like, wow, somebody really is understanding and knowing that every day we're going through this pandemic and just doing the best we can. Next slide. Strategies for increasing your sense of control, keeping a consistent daily routine when possible, ideally one that was similar to your schedule before the pandemic. And that's a nice thing to say, but those of us who had school-age children and were doing homeschooling, and those of us who were working different shifts and different times and leaving at different times of the day, know that that was a really hard thing to do. But getting adequate sleep, making time to eat some healthy meals, taking breaks during your shift and rest, stretch or check in with supportive colleagues, coworkers, friends, family. And when away from work, get exercise when you can, spend time outdoors, and either being physically active or relaxing. Do things that you enjoy doing during your non-work hours. In New York City, because of the restaurants being closed, one of the programs they had was they had restaurants, the city was purchasing meals from the restaurants, and then they were sending them into the skilled nursing facilities for the employees. So it wasn't every day that we had that, but quite often we did have these delicious, I'll tell you, healthy restaurant meals that were being delivered to us from the outside world. And they definitely did keep us going and increase the camaraderie with your colleagues when you're having a meal with them, obviously sitting 6 feet social distance. Take breaks from watching, reading, or listening to news stories, including social media. Hearing about the pandemic repeatedly can be upsetting and mentally exhausting, especially since you work with people directly affected by the virus. I literally did have to turn the TV off during this time. It was absolutely media overload. and it was too much, along with working with what we were working with, to come home every day and look at that on the TV. So just build your resilience is one of the things we're going to talk about. Just if you feel like you've been misusing alcohol or other drugs, just ask for help. If you were treated for any mental health conditions, just continue with your treatment. I know it's been harder with the pandemic, but there are video sessions that are available, and just make sure that you're doing what's best for you in this situation. Next slide. So what is resilience? Resilience is our ability to adapt or bounce back when things don't go as planned. Resilience is not about being without any problems, but it's about learning to deal with the problems by using tools and skills to stay strong and deal with the problems as they come up. Resilient people do not dwell on their failures or wallow in the negativity. They learn from their experiences or mistakes and they move forward. Next slide. So why is it important? It relates to how we view or react to adversity and stress. In every person's life, things don't work out as we plan, and failures do happen. But being resilient means that when these failures happen, you will have the ability to bounce back and function effectively instead of being cursed by failure. Resilience gives you resources and power to overcome life's setbacks and continue moving forward with your life. Next slide. So what does a resilient person look like? Resilient people tend to have a positive image of the future, and they maintain a positive outlook, and they see brighter days ahead. And I honestly think healthcare workers are resilient by nature. We are positive people. We come to work every day to do a job, and generally we put a smile on our faces because we know that that's what's important to the population that we take care of. Resilient people have solid goals and desires to achieve these goals. And I had read a quote recently, and it said, "A goal without a plan is just a wish." So it's important that we set goals for ourselves and then try to put plans in place so that we can reach these goals. Resilient people are empathetic and compassionate. They don't waste time worrying about what others think of them. Resilient people do not think of themselves as victims. They focus their time and energy on changing things that they have the control over. Next slide. Resilient people keep in mind that being resilient does not mean ignoring the problem or pretending that everything is just fine. Resilient people have problems, sometimes a lot of them, but being resilient means that they've learned how to view and relate to those problems differently and be more adaptive and positive ways. So some of the building blocks for resilience. The resilience is the capacity of an individual to navigate their way to psychological, social, cultural, and physical resources to sustain their well-being. Personal qualities such as competence, social support, adaptability, and purposefulness all work together to support resilience. In New York City, a lot of our healthcare workers are immigrants, and what you need to come to another country when English is not your first language, when the culture is very different than what you're used to, they've had some built-in resilience to begin with, being those people who were able to adapt to that. And I think that did absolutely help us a lot during the pandemic, that these were people who had seen adversity in their life before, and they were adaptable, and they adapted to the pandemic. Next slide. So confidence is having a feeling of competence, effectiveness in coping with stressful situations, and strong self-esteem and inherent feelings of resilience. The frequency of which individuals experience positive and negative emotions is also key. So I would say in management, it's important that we provide ongoing educational opportunities to our employees and keep them feeling competent in what they're doing in our building and in the care that they have for our population. And that also helps to build self-esteem. Purposefulness, having a clear sense of purpose, clear values, drive and direction, help individuals to persist and achieve in the face of any setbacks. Social support, building good relationships with others and seeking support can help individuals overcome adverse situations rather than trying to cope on their own. And I said in the beginning, I walked into a building after being corporate to work with line staff that had been in that building, some of them 20 years, 25 years. And, you know, the first day they weren't sure what they were getting from me, but when they realized that I was going to work with them and work side by side, and they just stepped up to the plate, they created relationships with me and me with them. And we worked as a team every night to make sure in the morning that all our tasks have been done and all our residents have been taken care of. Adaptability is flexibility and adapting to changing situations, which are beyond our control and are essential to maintaining resilience. Resilient individuals are able to cope well with change, and their recovery from its impact tends to be quicker. There were nights I didn't feel very adaptable. A lot of things coming at you, feeling at some point that I can't handle one more thing coming my way in this pandemic. But it's our ability to be somewhat flexible and our ability to bounce back from it. You may have a bad night, but you go back the next day and you find a better way to take care of the problem. So we're going to go through a series of questions in this next couple of slides. And if you want, you can write it down or just think about it. But it's about looking about how resilient you think you are. And the questions can help identify your sources of resilience and help identify areas which you might want to improve. So you're going to rate it from 4 being this statement is definitely true, 3, this statement is mostly true, 2, this statement is only partly true, 1, this statement is false, and 0, this statement is completely false. Next slide. So the first one is, I have a supportive relationship in my life. I can brainstorm other possible choices when confronted with a crisis. At an emotional level, I accept change as a part of life. I take action on decisions. I have goals and dreams for this year. I have hobbies or activities that express my creativity. I have tried new activities in the last year. I can list 5 personal strengths. Next slide. I have a strong sense that life is worth living. I have self-care strategies for managing strong emotions. I have positive self-talk messages. I take care of myself regularly. I am able to make meaning of suffering. I have relationships of mutual support in my life. I am able to choose from a number of options to solve problems. I thrive on change. I have well-defined goals. I solve problems quickly. I find my hobbies relaxing. I enjoy trying new things. Next slide. I am able to express my feelings openly. I have a positive view of myself. I focus on my strengths, and life is good. So if we just look at those statements and look kind of over, do I really agree with them? 4, or something I can't relate to might be a 0. we can assess the statements were all positive. So if you answered 3 or 4, it would indicate you have strong resilience in that area. Lower scores indicate that these are areas you might want to work on. You might want to do things. Every time I see the hobbies question, I sort of laugh to myself because I don't remember the last time I had a hobby. But I'm actually going to work on that because I do think that in order for me to build resilience and have a diversion, I feel like my whole life was pandemic for the last year and I had no diversions, that's something I could work on, and that could help me to build some more resilience for the future. So 10 ways to improve your resilience. Oh, polling question, sorry. So there's a polling question and it says, did you score 1 or 2 of any of those resilient questions? So we're polling. %69% so far did score 1 or 2, and 31% of us, that would not be me, by the way, 31%, did not score either a 1 or a 2 on any of those questions. So I think that we do have some work we can do on working towards building some resilience in our life. So make connections. Good relationships with family members, friends, and others are so important. Accepting of help and support from those who care about you and listen to your strengthens your resilience. Some people find that being active in civic groups, faith-based organizations, or other local groups provide social support and can help with reclaiming hope. Avoid seeing crisis as an insurmountable problem. You cannot change the fact that highly stressful events happen, but you can change how you interpret and respond to them. Try to look beyond and present to the future how future circumstances may be a little better once the crisis passes. And I think having lived through the pandemic now, or almost through the pandemic, we've learned a lot, and we've learned what kind of things we need to do, God forbid this ever happens again, that can improve not only how we care for our residents, but how we care for ourselves. Accept that change is a part of living. Certain goals may no longer be attainable because of adverse situations. Accepting circumstances that cannot be changed can help you to focus on circumstances that you can change. Next slide. So move forward towards your goals, develop realistic goals, do something regularly, even if it seems like a small accomplishment that enables you to move towards your goals. Ask yourself, what is the one thing I know I can accomplish today that helps me move in the direction I want to go? Take decisive actions, act on adverse situations as much as you can. Take decisive actions rather than emotionally detaching or wishing the problems or the stress will go away. Look for opportunities of self-discovery. People often learn something and experience personal growth because of their struggles. Look for the lessons in the challenges that you face and how you'll come out stronger, wiser, and better to be able to appreciate life. Next slide. Nurture a positive view of yourself, developing confidence in your ability to solve problems and trusting your instincts helps build resilience. Keep things in perspective, even when facing very painful events. Try to consider the situation in a broader context. Avoid blowing the event out of proportion. Maintain a hopeful outlook. An optimistic outlook enables you to have good things that happen in your life. Try to visualize what you want rather than worrying about what you fear. Take care of yourself, pay attention to your own needs and feelings, engage in the activities that you enjoy and find relaxing, exercise regularly, take care of yourself. It helps to keep your mind and body ready to deal with situations that require resilience. So this is just a slide that talks about resilient areas that I may want to work on and ideas to increase these resilience in this area. And I had said in the beginning that I really have no hobbies. So the resilience area that I would want to work on is those extra activities or hobbies. And then I need to set some realistic goals or ideas on how to increase my resilience in this area. What sort of hobbies, what kind of things do I like to do? Do I want to do? Maybe I did when I was younger, but have lost sight of them through the years of having children and grandchildren and working so many hours. So setting goals for myself, realistic goals on how to possibly decide what hobbies and then really work on getting involved in those hobbies. During a pandemic, starting new hobbies may not be the easiest of the resilience steps to take, but I think it's important that we look at all those different things, questions we answered, and really look at ourselves and our quality of life. So the breathing techniques, I put a couple of slides in here about breathing techniques, and you're probably sitting in your offices, so this is going to feel maybe a little silly, but there's a couple of breathing techniques I'd like to go through. I actually do think they really help. They really help at night when those of us who have insomnia are trying to sleep or trying to relax, or sometimes, they tell you to count to 10. Sometimes a breathing exercise during the count to 10 when you're getting very emotional about something is helpful. So breathing technique to decrease stress, it's to take a deep breath in. Now let it out. Even just doing that, you can notice the difference already. Just actually thinking about that breath in and breath out. It's a powerful tool that eases stress and it makes you feel less anxious. Simple breathing exercises can make a big difference if you make them a part of your regular routine. So before we get started, keep these tips in mind. Choose a place to do your breathing exercise. It could be in your bed, in your living room floor, or in a comfortable chair. Don't force it. Sometimes I feel like if I'm doing my breathing exercises, Alexa is very helpful with breathing exercises, by the way. But if you're forcing it, you're getting stressed over doing your breathing exercises. So that's not really helpful. Try to do it the same time once or twice a day. I generally do it at night before I go to sleep, and wear comfortable clothes. So deep breathing, we say you get comfortable. You can lie on your back in the bed, on the floor with a pillow under your head and knees, or you can sit in a chair with your shoulders and head and neck supported against the back of the chair. Breathe in through your nose. Let your belly fill with air. Breathe out through your nose. Place one hand on your belly and the other hand on your chest. And as you breathe in, feel your belly rise. As you breathe out, feel your belly lower. The hand that's on your belly should move more than the one that's on your chest. Take 3 more full, deep breaths. Breathe it as fully into your belly as you can. And then let them breathe out. I hope we're relieving some stress. So breathing focus. While you do deep breathing, use a picture in your mind and a word or a phrase to help you feel more relaxed. Close your eyes if they're open. Take a few big, deep breaths. Breathe in, and as you do, imagine that the air is filled with a sense of peace and calm. Try to feel it throughout your body. Breathe out. While you're doing it, imagine that the air leaves with your stress and tension. And now use the word with the breath. As you breathe in, say in your mind, I breathe in peace and calm. And as you breathe out, say, I breathe out stress and tension. And we're going to continue that for 10 to 20 seconds. Excellent. Next slide. Stress reduction takes purposeful steps in giving us permission to take care of ourselves. Your actions and care during this pandemic is amazing. You are true healthcare heroes, and I really want to thank you all. We want to thank you all. And we have time for questions.
Thank you, Barbara.
Yeah, Barb, I just have to make a couple comments myself. Sorry, I couldn't get my video back on. First of all,
Okay.
thank you for being vulnerable and sharing your personal story and really just kind of sharing where you were in terms of the resilience and kind of that assessment and where you fall and just kind of your real struggle during this period of time. I think the other thing that I appreciated is that you gave us the opportunity to do that assessment ourselves and to really become self-aware of, what does resilience look like and where am I, and being able to really have it and really tap into that resilience. Love the tips to improve, and thank you for taking us through the breathing exercise. I personally can attest to breathing as I would breathe in hope during the pandemic and try to let go of the stress. And so for me, that was just a real lifesaver. And I really appreciated you taking us through that exercise. So Debbie, we do have time for questions. What questions have come in? And let's really take advantage of Barbara's expertise here.
Absolutely. So again, thank you, Barbara. And to our audience, if you have questions, please place them in the Q&A box and we will get those over to Barbara. Barbara, there were several comments and, they said they love the breathing exercises, the tips on self-care and resilience. Somebody said that it was an insightful program and they're sending virtual hugs. So that always feels good, doesn't it?
With 6 feet social distance, but yes, those hugs are good.
Absolutely. So there is a couple of questions. So is it possible to share your assessment with us? It says.
Absolutely, I can get that to you.
All right. And so Barbara, if you'll just send that over to myself, the Greenhouse Project, then we can include that in the recording and the slides that go out. And we'll be doing that either this afternoon or tomorrow sometime. So everybody will get a copy of that. Let's see if there's some other questions here.
I think I would like to also say that I really do appreciate people participating in the breathing exercises. And I think it shows how much we all really needed that. And we are looking for ways to relax and de-stress, because our lives were stressful before, and then we just added, the pandemic just added a whole nother level. So I think people are looking for ways to de-stress. And I do find the breathing exercises also very helpful. Maybe when they get home and they can try them actually relaxed in their beds or, in a more comfortable place, but they are very, very helpful.
Well, I just have to add my 2 cents. While you were doing it, I did it as well. And I didn't realize how much stress can accumulate in a day. And even to just take a break and just say, I'm going to give myself 5 minutes and really be intentional about breathing. And my office door is shut. And so I had the quiet space. My video camera was off and I could close my eyes and actually do it. So I think, I appreciate that challenge. And for all of us to really, it takes intention to really go there and to do what you just recommended we do. There's so much science behind the practice of breathing, and it's a very simple, inexpensive way to really de-stress and decompress and literally breathe in that hope, that peace, that calm, and get rid of some of that. It's a powerful visual that really does translate to us physically and mentally.
And giving ourselves permission.
Right.
We're so used to giving to other people, being nurses and healthcare providers, that to give ourselves permission to take some time out of every day, even if it's just for this breathing, but also to look at that resilience, that questionnaire, and to really look at some of the areas. You can't work on every area at once in your life, maybe, but if you pick one or two of those areas that it identified for you as being an area that you could use to work on improving resilience, I think that and then set goals in those areas.
Absolutely.
Those are great suggestions. I know that I use aromatherapy, and it does cause you to just breathe and focus. So there's all kinds of ways to do this. So being that there are all kinds of ways, there is a question that says, many nurses don't have an office that they can retreat to, as you well know, Barbara. How can you find ways to relax, but still be, in your role as a nurse when you're in that environment of providing care?
It's a great question. I think we're coming into outdoor space time. And I do think it's really important as nurses or as caregivers or CNAs that when we have break time, to get off the unit, to go someplace, to go outside, to take a walk, to get some fresh air. The other thing I found was so helpful, and I think I said it, was just my colleagues. We were sort of all in the same boat, and we found comfort in each other. So I think it's important that we spend time with each other, not just in the hard work, but also I think laughter is so helpful and keeping a positive attitude. So for the nurses, when they're asking, I think most nurses don't have offices to get away to. So just getting outside of the building and getting a few deep breaths in, I think would be very helpful.
Okay. All right.
I appreciate, Debbie, while you're looking, the part about laughter. And I did notice that Eric Reguera with the Jewish Home Family is on the line. And I remember they were just, to me, exemplars of bringing laughter in the most challenging times, but in some of the things that they did, and laughter, they say, is the best medicine. And, let's try to, even at horrific times, it's not making light of it at all, but to, again, acknowledge the power of laughter to really have an impact on us physically.
There's a comment, smiles are free medicine.
Yes, here to that.
Well, and, we wore masks. So a lot of people didn't see our smiles, during the pandemic. So I think it's important that we get back to it.
Absolutely. There was a lot of commentary this last year about post-traumatic stress. And one of the question is, have you heard much about that particular type of experience happening in long-term care, and any thoughts on how to best support staff who may have had post-traumatic stress or still dealing with it?
I often say I have post-traumatic stress. And I think for me, in my role, the way that I've been, am I still on? Because I'm just,
yes.
Okay.
Yes.
Mm-hmm. Sorry. For me, it's about planning for the future and looking at different things to make sure that if this ever happens again, that I'm prepared. So in my personal way, that's how I'm working on post-traumatic stress. I think for our staff members, I think it's absolutely something that they're dealing with. I think it's absolutely, and I think they will feel better and less stressed if they feel that us as facilities and as management team are better prepared for anything that may come down the road, you know, in the future. And I think, you know, having the, you know, I'm going to say we're prepared, but next time might not be a pandemic. It could be another emergency. So we just have to keep in mind that we're responsible for not only our residents, but our staff, and that we're prepared to take care of them, whatever comes down the road.
Are there any experiences that you would share for maybe an organization to consider doing in relationship to really retaining the staff that they have, maybe attracting staff that have left? I know that during this pandemic, there were a number of staff members who, for different reasons, needed to leave, and you know, we hope that we can attract them back. But did you see anything amongst employers that you thought was unique, or that they might take into consideration in making sure that they try to have those kinds of programs, supports for people?
I think in what I read and all the different articles, what I've seen is a lot of people trying very hard to do what they think the staff wants. But I think we have to ask the staff what works for them. And, you know, it may be looking at the shifts and the way they work with working mothers. And it may be being adaptable to adapting our care to their lives more than their lives to our care. But, you know, one of the things we were looking at, even here in New York, we're struggling to get staff back. And, you know, we've been offering 2-day-a-week shifts because they can't pay the childcare because the schools are still closed. So they need the extra unemployment money, but they could come back 2 days a week and it doesn't affect their unemployment. So just sort of ways to accommodate the staff. The staff are not coming, my staff that I know are not coming back because they don't want to come back to work. They're not coming back because it doesn't make financial sense when they have to pay for childcare. So, you know, is there a way to put something in place, to put in something adaptable to be helping out the staff with what their problems are, what their issues. Again, I have an elderly mom living with me. There is no more adult daycare. They're all closed. You know, are they coming back? I hope so. You know, but for right now, I need somebody to come in, and then I need somebody that has a COVID vaccine to come in. And it's just a very complicated time. So I think the slide that says, what can we do for staff? Ask them, was very eye-opening for me as I went through the presentation, because I really do think that it's going to be different for different people. For some people, it may be about money. For some people, it may be it's just too hard to go back after the loss that they've seen.
Well, certainly knowing the person is something that the Greenhouse Project talks a lot about, and it's knowing the elders that we are in partnership with, but it's also knowing one another as team members, and what I need may not be the same thing as what you need. So those were terrific insights. And so again, thank you, Barbara, for sharing that. And to our audience, we are going to send out the link for the recording today, for the slides. And if you are a nurse and seeking contact hours, a link will also be sent to you so that you can get your contact hours.
And I just want to thank you guys so much. This was a great opportunity, and I'm so impressed with the Greenhouse Project, and what I see is just amazing.
Well, thank you, Barbara. We were just thrilled to have you a part of this and to really take on a topic that, in my opinion, is one of the most significant topics for us to address. I've heard it referred to as the parallel pandemic, and the PTSD that could go on and on and on. And so really being intentional about creating strategies to help us build resilience and to support one another. And Debbie, thanks for acknowledging the model and our not one size fits all approach, and to really be highly individualized. I love the ask the staff. And sometimes it's just a matter of asking. So Barbara, thank you. And to Select Rehab, our sponsor, once again, thank you so much for your support. We again want to honor nurses and really thank them for their heroic efforts. Again, not just during the pandemic, but obviously through the pandemic. I think you were on full display who you are as the caring, compassionate people. So just wanted to let you know that there is another, Janet, I think we've got some closing slides. There is another Select Rehab webinar that we are going to do. It's on June 15, and that's where we're going to focus on PDPM. So really looking forward to that. You'll want to mark your calendars for that date, June 15, 3 p.m. Eastern time. And once again, we'll welcome back our sponsor, Select Rehab, to really take us through PDPM, which is certainly one of those hot topics. On the next slide, we want you to save the date as well for a cultural transformation workshop. And this is where we're really going to take a look at taking the greenhouse core values and how do we infuse those core values into our traditional long-term care environments. So it's a session you're not going to want to miss. We're really excited about really leveraging our core values and our lessons learned to really apply this more broadly into traditional environments. On the next slide, once again, thinking about where we are going in the new frontier. We're calling it Dementiaverse. It's a whole new universe. And really, really looking at this, what are we learning? What is evidence and emerging research tell us about what's going on in terms of best practice with regards to supporting those living with dementia? September 14, you will not want to miss it. We are hoping to launch registration within the next 2 weeks. So stay tuned for all the details on that. And last but not least, I think one of my most favorite things to do is interview some of the most amazing thought leaders around the country and get their insights and thoughts into what we must do to elevate elder care. And as Barbara certainly reminded us of the incredible tragedies that occurred among elders and among the staff that support them by way of COVID, deaths and mortality rates, we really want to do everything we can to seize this opportunity to elevate elder care and to really build upon what we've learned that works. So with that, thank you all for your time, your attention. Barbara, once again, thank you so much for your incredible work and for putting together an amazing presentation. I hope all of us will just breathe and do that assessment, but really you gave us some wonderful tools to be able to apply and to hopefully build resilience. So with that, thank you, everybody. A big salute and debt of gratitude to our nurses and healthcare heroes out there. Take care, everyone. All right. Bye-bye.